Public Health England and the CCG to ensure all appropriate actions are taken.
The answer phone message no patient wants to hear. But this GP surgery in Buxton had no choice but to close. Linked to the latest coronavirus case in England, a nearby primary school also shut its doors. One of the 3 new cases is said to be a parent of a child here. A local resident filmed this convoy of ambulances she believes were en route to collect the patient.
They parked 2 vehicles next to each other and 2 behind. They all got out, went into one ambulance and put on white suits and masks with head torches, and they got back in their ambulances and just dawdled off up to a house.
In the last few hours, Northern Ireland confirmed the UK's 3rd case, its first. The patient had recently travelled back via Dublin airport from northern Italy, the centre of a serious outbreak.
We have well tried and tested approaches for identifying people who have been in contact, for contact tracing those, for following up, for giving them advice and taking appropriate precautions to protect the public.
2 of the new infections are linked to Italy, the other to Tenerife, where guests at this hotel remain in quarantine. Anthony Wilkins came home just before it went into lockdown. The government is now advising anyone who's recently stayed there to self-isolate, advice that directly contradicts what Anthony says he's been told.
We, as ordinary people, need to be reassured with what I would call decisive information, and I don't feel that we got that decisive information.
Growing concern about the deadly virus raises questions about how it's being handled here.
Isn't it time now that the Prime Minister came out to reassure the public and set up a task force to deal with it?
We have a drumbeat of COBRA meetings and meetings with the Prime Minister and reporting into Cabinet, which is how a government should function in order to deliver the very best decisions based on the science to keep people safe.
For now, contact tracing and isolation are containing the virus, but preparations are in place if it gets worse. A drive-through testing bay is being trialled at West London Hospital, and other measures to help delay any outbreak are under constant review.
Some of the things we have to do are going to come at a social cost. Everybody knows that the kinds of things you consider are reducing mass gatherings, school closures, which may or may not be appropriate for this particular virus. We don't know yet. We need to find that out. There are several other things. Now, to be clear, we're not saying we will do them, but we have to look at all of them.
Any measures like that would have to be in place for a number of months. For now, the government says we must wash our hands and cough into a tissue, the best way to limit the spread. Emily Morgan, News at 10.